Today in Macon, families and patients made emotional pleas for Georgia to expand medical cannabis access. They spoke at the Georgia House Committee hearing at Mercer University.
The committee was formed after a bill expanding access to medical cannabis stalled in the state legislature this past session. Hunter King spoke with advocates as they talked about their personal struggles under the current law.
The room was full on Thursday as about a dozen people shared their stories with lawmakers. Former State Representative Micah Gravely says his 74-year-old father is battling cancer and undergoing preventative chemotherapy that has left him weak and without appetite.
To see the weight loss and to see just kind of the lack of energy and the loss of appetite, it was really concerning as someone who worked very hard during my time in the legislature to help people like that.
Gravely says Georgia's current law forces patients to wait until their conditions become severe or end stage before they're allowed to buy medical cannabis.
If I get diagnosed with something and I know that medical cannabis can help, I want to be able to take that immediately.
Jennifer Conforti says her 14-year-old daughter was diagnosed with a brain defect and profound autism. At age 3, the girl developed severely harmful behaviors.
I was able to get her off of her pharmaceuticals and only on cannabis, and she's been taking cannabis every day for the last, 11 years.
Conforti says most parents in the special needs community don't know medical cannabis dispensaries exist in Georgia. Advocates also warn that restrictive laws force patients to seek dangerous alternatives on the street, like products that could contain fentanyl. The committee said they will gather testimony and presentations from their meeting around the state and make recommendations to the Assembly this year. Reporting in Macon, Hunter King, 13 WMAZ News.
According to the Georgia Access to Medical Cannabis Commission, Georgia's law is much more restrictive than in some other states. It doesn't allow growing or selling marijuana in plant or leaf form or allow doctors to prescribe it. It also bans the use of food products infused with low THC oil.
Medical marijuana use has been legal in the state for the past 10 years after legislators passed the Haley's Hope Act. It was inspired by then 4-year-old Haley Cox, who suffers from epilepsy. Since 2015, lawmakers have spent several years working to make medical marijuana more accessible for those who need it.
In the most recent legislative session, Georgia lawmakers proposed Senate Bill 220, also known as the Putting Georgia's Patients First Act, to help expand the program, but that bill never made it through and did not become law. The bill would have renamed low THC oil to medical cannabis, removed severe or end-stage requirements for certain conditions, and opened access for several other medical conditions. That bill is expected to carry over into the 2026 legislative session.